talked about the proposed rules, but we didn't hone in on what was finalized. In the next few videos, we will break down areas that are interesting from both the 2022 Hospital Outpatient Prospective Payment System, or OPPS, and Ambulatory Surgical Center, ASC Payment System Final Rule, as well as the Physician Fee Schedule. In this particular video, we will discuss OPPS Final Rule on Civil Monetary Penalties and the Hospital Outpatient Quality Reporting, or OQR, program. On November 2nd, 2021, the Centers for Medicare and Medicaid Services, or CMS, finalized Medicare payment rates for hospital, outpatient, and ambulatory surgical center services. In addition to updating the payment rates, the calendar year 2022 Hospital Outpatient Prospective Payment System, or OPPS, and ASC Payment System Final Rule includes policies that align with several key goals of the administration, including addressing the health equity gap, fighting the COVID-19 public health emergency, encouraging transparency in the health system, and promoting safe, effective, and patient-centered care. The final rule will also further the agency's commitment to strengthening Medicare and uses the lessons learned from the COVID-19 public health emergency to inform the approach to quality measurement, focusing on changes that will help to close the health equity gap. Hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Our first topic is the increase in Civil Monetary Penalties, or CMP. CMS is setting a minimum CMP of $300 per day that will apply to smaller hospitals with a bed count of 30 or fewer, and a penalty of $10 per bed per day for hospitals with a bed count greater than 30, not to exceed a maximum dollar amount of $5,500. Under this approach, for a full calendar year of non-compliance, the minimum total penalty amount would be $109,500 per hospital, and the maximum total penalty amount would be $2,007,500 per hospital. This approach is scaling the CMP amount, retains the current penalty amount for small hospitals, but increases the penalty amount for larger hospitals, and affirms the administration's commitment to enforcement and public access to pricing information. They are not playing about the money and this transparency. It is getting real. So stay tuned. Next, let's look at the Hospital Outpatient Quality Reporting, or OQR program. The Hospital OQR program is a pay-for-reporting quality program for the hospital outpatient department setting. Hospitals that do not meet the program's quality reporting requirements receive a reduction of 2.0 percentage points in their annual payment update. In the calendar year 2022 OPPS ASC Final Rule, CMS is finalizing proposals to adopt 3 new measures: the COVID-19 vaccination coverage among healthcare personnel measure, beginning with the calendar year 2022 reporting period, breast cancer screening recall rates measure, again beginning with the calendar year 2022 reporting period, and STEMI ECQM, beginning as a voluntary measure for the calendar year 2023 reporting period, and then as a mandatory measure beginning with the calendar year 2024 reporting period. They are also making the reporting of 2 voluntary or suspended measures mandatory, requiring OP37A through E, outpatient and ambulatory surgery consumer assessment of healthcare providers and systems, survey-based measures beginning with voluntary reporting for the calendar year 2023 reporting period, and mandatory reporting beginning with the calendar year 2024, and finalizing to require OP31 cataracts improvement in patient's visual function within 90 days following cataract surgery, beginning with the calendar year 2025 reporting period, instead of the proposed calendar year 2023. And they are removing 2 chart abstracted measures under removal factor 4. The availability of a more broadly applicable, and this would be across settings, populations, or conditions, measure for the particular topic. So fibrinolytic therapy received within 30 minutes of emergency department arrival, OPP-2, and median time to transfer to another facility for acute coronary intervention, OPP-3. And they are updating the validation policies of the hospital OQR program to reduce provider burden and improve processes. You have learned about the increases in the civil monetary penalty. You have also learned about the finalized changes in the Hospital Outpatient Quality Reporting Program. Questions of the day. Were you aware of these updates in the final rule? And I guess a better question is, how do you keep up with these updates and changes? Let me know in the comments. I would love to hear your thoughts. My final thoughts: I think it is fair to have civil monetary penalty values that align with the bed count for the facility. Smaller facilities should pay less than the larger facilities. Also, reviewing the changes in the Hospital Outpatient Quality Reporting Program shows the value of the comment period. Several of the proposed rules were changed after review of the commenters' points and positions. Once again, it shows the value of speaking up and letting the powers that be know your concerns and allowing them to weigh in. Advocacy at its best. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out.
Are you interested in medical coding, but not sure where to start, and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or asking a question. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at prncoding.edu. Let's stay connected and connect others. You have stayed until the end of the video. Now, let me know where you are checking in from. And if you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.